with Dr. Benita Zahn.
And welcome. We're talking about sepsis. More than 200,000 cases a year are diagnosed in this country. Now, sepsis is the body's response to an infection. It's an out-of-control response, and it can be deadly. Early diagnosis and treatment are key. And since most cases happen at home, it would be great if there was a way to ID it. Well, there is, and that's what our guest, Al Cardillo, President and CEO of the Healthcare Association of New York State, is here to explain. Hi, Al.
Good morning. Hello, Benita.
I know that this is so near and dear to your heart, and you work so hard to educate us about sepsis. So before we get into what you're proposing, and offering now for home ID, what do we need to know about sepsis and how quickly it can really explode in one's body?
Well, sepsis can respond very, very quickly, and that's why awareness is so critical. Mortality increases something like 8% for every hour in which treatment is delayed. And very often it's the lack of the identification of the symptoms by either an individual or even a health professional that enables that delay process, which then becomes very serious risk to the individual. One thing I would show you is that this is, I don't know if you can see it, this is a card called Time, and this is available from Sepsis Alliance. And the word time is important not only because it emphasizes the need to be very timely in identifying and responding, but also because that acronym stands for the signs and symptoms that are reinforced through the word.
So let me walk you through that. The T stands for?
The T stands for temperature. So either a high temperature or a lower temperature.
And then you've got I.
I stands for infection.
Mm-hmm.
With sepsis, it's always the body's response to an infection.
And we've got M.
M stands for mental decline, confusion, or an altered mental status that very often accompanies sepsis.
Mm-hmm. And then you've got E.
E stands for extremely ill, like feeling like you might die, and that individuals that have these symptoms really need to contact their physician right away, their healthcare provider, 911. It's very important that individuals be very conscious of what these symptoms are.
Al, let's talk a little bit about the whole push for home identification. Look, a lot of people get a scrape, and it gets a little red, and it may get hot to the touch, and maybe a little icky. Well, that's kind of common. How do you know when you've gone from, okay, kind of common to, oh my goodness, you're in big trouble?
Well, I think it's important at the front end to never take these things for granted, cuts, scrapes, potential sources of an infection. We got into this at our level because 80 to 90% of sepsis cases originate in home and community, and typically, while sepsis can affect the healthy, the ill can affect anyone, the young, the old. 65% of the population affected are elderly, and individuals with compromised immune systems, disabilities. Recurrent pneumonia, urinary tract infections, those are among the high-risk individuals. Those individuals that are served by the home health system really mirror that population I just described.
Besides the time, what else are you trying to, encourage us to know at home?
Well, I think again, it's the vigilance with respect to any kind of a cut or an injury or the symptoms that I'm describing here. What we did as an association is recognizing that there was really nothing in place that was a formal screening process for signs and symptoms in older adults or anybody that was receiving health care in the community. We created this clinical screening tool about 4 years ago, working with national and state experts. And that tool is used to screen every patient on every clinical visit in home health. I shared with you some studies in advance of this showing that the process is being very effective in terms of identifying those symptoms early and getting individuals in touch with their medical professionals.
And before I let you go, Al, everybody's afraid to make the phone call and then look foolish because it was nothing. The impression I get from you is make the phone call because it may not be nothing and you can save a life.
Yes, and actually one thing that's part of the part of the Council of Sepsis Alliance, the End Sepsis, Rory Stoughton Foundation, and others that are very involved in this, is that if you're feeling these kinds of symptoms, when you make that call to the doctor or to 911, you say, I think it might be sepsis. Now, certainly we're not trying to we're not trying to prompt every time someone gets a cut or a scrape to call 911. However, what's important is, just like with symptoms of a heart attack or stroke or anything, to be vigilant about first of all in early prevention, but also in following through when you perceive that these symptoms are really progressing. So if you have an infection and then suddenly you feel a fever, then you're feeling confused, it's important to act.
And we'll let that be the last word. Al Cardillo, thank you so very much. Really important information, and lives hang in the balance. And for more information on sepsis, check out the links page right here at WNYT.com. We'll see you next time.